Assalamu alaikum guys. So today we are here with the last lecture of our today's day. So the topic is salivary proteomes, a prognostic window for malignancy prediction. So the guest speaker is Dr. Shafaq Saeed. Without any delay, I would ask Dr. Shafaq Saeed to join us. Assalamu alaikum, ma'am. How are you?
I'm good. How are you, Dr. Farooq?
I am also fine, ma'am. From here you can carry out. Thank you.
Thank you so much. So, Assalamu alaikum to all the viewers. Dr. Farooq already introduced me that I'm Dr. Shafaq Saeed Roge and I am from Bakai Medical University. I'm here to present on salivary proteomes, a prognostic window for malignancy prediction. Now, the first thing which states, the topic states is salivary proteomes. Now, what is proteomes? Simple language में proteomes basically होते हैं प्रोटीन्स वो प्रोटीन्स को बेसिकली कहा जाता है प्रोटियोम्स और इसकी स्टडी जो होती है वो कहलाती है प्रोटियोमिक्स. Now we all know that there are total set of proteins which are expressed in a cell at a given time, and these proteins when they break down they give up sugars, nucleotides, amino acids and lipids, and they perform certain kind of functions. Now the thing is that is there any proteins within our oral cavity or unka koi function hai? So yes, there are proteins in our oral cavity, and where are they? They are in the fluid released by the salivary glands. They are also released by the cells which are present in our oral mucosa. So within our saliva, basically saliva क्या है? हम उसको मिक्स saliva भी कहते हैं, whole saliva भी कहते हैं, oral cavity fluid भी कहते हैं. And looking at the composition of saliva, it has 99% water, 98.5 to 99% water, 1% organic components, which are all the proteins within the saliva, and they have certain biological functions, all these proteins. And then there are certain inorganic components, 0.5%, which include sodium, potassium, calcium, phosphate, carbonate, and sulfate. Now, these proteins, they have certain biological processes. For example, they protect against the pathogens. Then they have buffering properties against the inorganic molecules. They help in digestion. They help in lubrication as well. Not only that, they also detects the pathological conditions. They can be used as a biomarker for early detection of any disease. There are numerous studies which states that these salivary proteins helps in the detection of oral squamous cell carcinoma, uh, Sjogren syndrome, mental disorder, Wilson disease, and other dysregulation, immune and stress pathways, and all these disorders. Further, that they helps in the detection of Zika virus, diabetes mellitus, cystic fibrosis, and whatnot. So there are few studies which have suggested that these proteins acts as a markers, biomarkers की तरह ये act करते हैं, and they are approximately 3,000 or might be more than that differentially expressed proteins and peptides present in our saliva. Okay, now at the beginning of my lecture, I told you that these proteins are not only released in the saliva from the salivary glands, but there are cells within our oral mucosa, which are macrophages, granulocytes, fibroblasts, endothelial cells, mast cells, and lymphocytes. There are proteins released from these cells also, and these proteins are known as cytokines. ठीक है, हमें ये पता है कि ओरल म्यूकोजा की लेयर्स होती हैं, एपिथेलियम होता है, कनेक्टिव टिश्यू होता है, उनके सेल्स होते हैं. ठीक है, कोई भी चेंज, if there is any change within our oral mucosa, ठीक है, कोई भी डिजीज है, कोई भी ट्रॉमा है, हमारे जितने भी म्यूकोजा के सेल्स हैं वो हमारी बॉडी को इंडिकेट कैसे करते हैं? बाय द हेल्प ऑफ दीज प्रोटीन्स. यानी कि ये सेल्स क्या करेंगे? प्रोटीन्स हमारे स्लाइवा के अंदर सिक्रीट कर देंगे. यानी कि एक सिग्नलिंग प्रोटीन की तरह ये काम कर रहा होता है, सिग्नलिंग मैकेनिज्म की तरह काम कर रहा होता है, जो कि अपने रिसेप्टर के साथ जाके बाइंड करेगा, एंड दे विल इन्फ्लुएंस अ नंबर ऑफ एक्टिविटीज. फॉर एग्जाम्पल नॉर्मल ग्रोथ, ठीक है, ट्रॉमा के केसेस में एक ग्रोथ कराएगा, टिश्यू रिपेयर कराएगा, एंजियोजेनेसिस, देन सेलुलर डिफरेंशिएशन एंड सेलुलर proliferation. So these proteins are known as cytokines. I have worked on one such cytokine which is released from fibroblast cells. Basically, fibroblast cells release two kinds of biomarkers, that is acidic fibroblast growth factor and basic fibroblast growth factor. I have worked on basic fibroblast growth factor. I would like to tell you regarding the basic fibroblast growth factor. So basic fibroblast growth factor is a cytokine, is a protein which is a strong inducer of proliferation and fibroblast migration and helps uh, and promote the capillary formation and accelerate tissue regeneration. What I did in my study was I collected the unstimulated saliva from the patients who reported to the dental OPD of Abbasi Shahid Hospital and Ziauddin University Clifton campus, and all the saliva was processed after being centrifuged in the multidisciplinary research lab of Ziauddin University. Overall, I inducted 180 participants in my study, out of which 90 were considered as controls, that is, they were the healthy individuals. They had no other kind of disease. And in order to create the baseline, that what were the levels of basic fibroblast growth factor in the saliva of the individuals who are not exposed to any of the carcinogen, who are not using any of the chewable smokeless tobacco. And the other were 90 were taken as cases. There were patients who reported to the dental OPD with oral submucous fibrosis. They were already diagnosed patients of oral submucous fibrosis. This was a case control study, and the sampling technique which I used was non-probability consecutive sampling technique, and all this study was done after taking an ethical approval. So the patients which I included, the subjects which I included were demographically matched subjects, that is, they were of the age range of 18 to 65 years of age, and the controls were taken as the healthy individuals who were not exposed to any of the carcinogens, whereas the cases were the individuals who were diagnosed with OSF with or without habits. It depends, because I needed to see that patients with OSF उनमें क्या level था BFGF का and without habits में क्या level था. So all those patients who had any kind of metabolic immunocompromised disorders, local and systemic inflammatory disease, who were using any kind of corticosteroids, immunosuppressants, any history of malignancy, pregnant and nursing mothers, they were all excluded in this study. After collecting the unstimulated saliva from the patients of 18 to 65 years of age, the saliva was collected by using the passive drool technique. Uh, I, I, I also have taken the verbal and the informed consent, and regarding their habits, demographic profile, and tobacco products and habits, I use the performer. After collecting their saliva and after centrifuging them, I did ELISA, enzyme-linked immunosorbent assay, specific for human BFGF to measure the level of salivary basic fibroblast growth factor in saliva. So after doing the ELISA, I waited for my results, and the results were basically out of 180 participants, 64.4% were males and 35.60 were females. Then out of 90 cases, 86.6% were patients with oral submucous fibrosis, and the 13.40 were reported to have other oral premalignant lesions. So when I asked them regarding their habits, control were they were completely healthy individuals. They were not using any kind of tobacco. Whereas for the cases, 44 of them reported that they were using betel nut, and the rest of them were using mawa, gutka, and pan, and other smokeless chewable tobacco. And most of them stated that they were using betel nut for the past 10 years. That is, 52 of them reported that they were using betel nut for the past 10 years, and that is why they have reported to the dental OPD, because they were having limited mouth opening. So it was oral submucous fibrosis after clinically diagnosing them and after proper results. When I assessed their saliva, so the controls, the salivary levels of basic fibroblast growth factor in controls were 2.59. That is, minimum was 1 and the maximum was 11.6, with the mean and standard deviation, with the mean was 2.59 and the standard deviation was 2.44. Whereas in the cases, The minimum levels were recorded as 2.18, whereas the maximum levels of basic fibroblast growth factor reached till 23.41, with the mean of 8.97 and with the standard deviation of 2.96, and these results were statistically significant. So now looking at the results, I can easily state that if 2.18 is minimum and 23.41 is maximum and the mean is 8.97, so the patients with with the cutoff value of 8.97 and beyond that, the patient is at the risk of turning the pre-malignancy into malignancy. Kaise? All the pre-malignant lesions, they don't have the potential to convert into malignancy. ठीक है? But we need to remember this, तमाम malignancy हमारी उसका first step pre-malignant lesion ही होता है. So if we get the cutoff point that beyond 8.97, the patient is at the high risk that this pre-malignancy can turn into a malignancy, we can be able to save the patient. So I compared my study with other studies as well, and some similar results were found. In my study, I have taken saliva, and there was one of the study in which the salivary basic fibroblast growth factor levels were evaluated in the salivary gland tumor. Okay? And this study also states that the levels of salivary basic fibroblast growth factor were raised in the patients with salivary gland tumor as compared to the healthy individuals. Okay, then Archana Gupta in India in 2019 also reported that she checked serum saliva and performed ELISA, and she also states that the individuals who were diagnosed and untreated with OSCC patients, the group 1 was diagnosed and untreated OSCC patients, group 2 were treated OSCC without reoccurrence, and group 3 was controls. And you can easily see that the levels of salivary basic fibroblast growth factors are raised and approximately near to what I have told, that 8.80 is the cutoff value in the patients with the diagnosed and untreated OSCC patients. यानी कि वो patients जिनको कैंसर डायग्नोज हो गया था उनके अंदर ये लेवल आ रहा है, 8 लेवल आ रहा है salivary basic fibroblast growth factor का, whereas अगर आप OSCC ट्रीट कर देंगे तो ये प्रोटीन का लेवल गिर जाएगा. So looking at the other studies throughout the world and talking about my study, I can easily conclude that elevated levels of salivary basic fibroblast growth factor in already diagnosed cases of OSF, there was a significant difference between cases and controls. Okay, then I did one more study. There was one more proteins that was resistant, salivary resistant in oral pre-malignant individuals. And I did this study. This marker was an inflammatory biomarker, and epidemiological studies and the literature review says that this biomarker is raised in inflammatory conditions. Okay, and periodontitis का ये बहुत अच्छा बायोमार्कर है कि ये बता सकता है कि किस पेशेंट को फ्यूचर में जाके पेरिडोंटाइटिस अटैक हो, although periodontitis is very common in our state of population. But not only this, salivary resistant association दिखाता है periodontitis and diabetes mellitus का भी. Diabetes mellitus में भी ये बायोमार्कर raised होता है and it is expressed in our oral cavity. So I did this result on salivary resistant and oral pre-malignant lesions, but unfortunately the results were not very statistically significant in the oral pre-malignant lesions. But yes, the literature review says that अगर diabetes mellitus के patients में या अगर हमने ये diagnose करना है कि future में किस patient को जाके diabetes mellitus, which patient is at the risk of diabetes mellitus, this biomarker जो है it plays a very important role. Then there was one more study by one of my colleague, Dr. Arslan Rafat. He also checked the levels of S100A7 in oral submucous fibrosis patients, and it has been reported that the levels of this salivary S100 A7 were raised in the patients with oral submucous fibrosis. Hence it proves that whenever there is any change coming in the oral cavity, oral mucosa, हमारे cells जो हैं वो proteins release करते हैं, वो हमारे indicators हैं. They are the best indicators of telling that future में हमारा patient कितने risk पर है. So looking at all these studies, हम लोग बहुत इजीली ये कंक्लूड कर सकते हैं, बिकॉज वंस एक पेशेंट को मेलिग्नेंसी हो गई, OSCC हो गया, देन वी हैव नो अदर चॉइस कि हम उसकी या तो बायोप्सी कराएंगे और उसके बाद उसकी हम लोग कीमोथेरेपी, रेडिएशंस कराएंगे, तो और सर्जिकल रिमूवल्स कराएंगे, तो वो पेशेंट रिस्क पर पहुंच जाएगा. तो व्हाई नॉट टू सेव द पेशेंट व्हेन इट इज़ इन द प्री मेलिग्नेंट स्टेज. जब हमें पता लग गया कि हाँ लेवल्स इतने आ रहे हैं सलाइवा के अंदर और ये पेशेंट एट पोटेंशियल रिस्क है, तो व्हाई नॉट हम पेशेंट को उसी टाइम पर जो है उसकी ट्रीटमेंट देना स्टार्ट कर दें और उसको मेलिग्नेंसी की तरफ जाने से हम रोकें कि भाई यू नीड टू कट ऑफ दीज हैबिट्स, यू आर एट द हाई रिस्क, एंड क्यों ना इस पेशेंट को हम मॉनिटर करके हम रोक सकें. बिकॉज लुकिंग एट द करंट कंडीशंस ऑफ अ कंट्री, OSCC is considered as 15 times, the incident rate of OSCC is 15 times greater than that is in the worldwide. That is 5%. दुनिया में incidence rate मिलता है 5%, हमारे यहाँ 15% पे पहुंच चुका है. सेकेंड मोस्ट कॉमन mortality rate हमारे यहाँ जो है वो ओरल सबम्यूकस फाइब्रोसिस से हो रहा है. ये मोस्ट कॉमन डिजीज है ऑफ द हेड एंड नेक कैंसर रीजन के अंदर, और हमारा स्टेट बहुत ज़्यादा कॉमन है हमारा इंडिया का. तो व्हाई नॉट टू सेव द पेशेंट एट अ वेरी अर्ली स्टेज और उसको हम आगे फर्दर जाने ना दें, क्योंकि वंस देयर इज अ मेलिग्नेंसी, it not only affects the patients, it affects their quality of life. It is a big trauma for the family as well. It affects the family as well. So we can save the patient by the early diagnosis, and the salivary biomarkers can act as a diagnostic tool for the early prediction of the malignancy. Thank you so much. This was all about today. I hope you liked it, and you can ask me any questions if you want. Thank you.
Thank you, Dr. Shafaq Saeed, for a very informative informative lecture. Jazakallah for the time. Ma'am, कोई क्वेश्चन हुआ तो इंशाल्लाह मैं आपको ईमेल या मैसेज कर दूंगा. Jazakallah for the time. Thank you guys. फिर इसके साथ आज का हमारा डे खत्म होता है. कल इंशाल्लाह हम बाकी दूसरे लेक्चर के साथ दोबारा आएंगे. Thank you ma'am again for your time.
Thank you so much, Dr. Farooq. Thank you so much.